Hello, I'm Dr. Melissa Martin, Senior Principal Clinical Psychologist, and the two colleagues presenting with me are Dr. Holly Thompson, Clinical Psychologist, and Susan Lavin, Assistant Psychologist, and we're part of the NHS Greater Glasgow and Clyde Older People Psychology Service. And today we would like to welcome you to this webinar, which explores communication difficulties in people living with dementia. Communication is how we understand and how we are understood by others. The loss of the ability to speak or process speech correctly can be absolutely devastating for someone with dementia. Communication is not just verbal, it can also involve non-verbal type of communication, which we'll discuss later. Understanding communication difficulties in dementia and strategies to enhance communication is therefore key to providing good quality care for a person with this diagnosis. Strategies aimed at increasing attention and understanding and simplifying conversation will improve communication skills between people with dementia and care providers. Unfortunately, however, healthcare professionals and family caregivers usually receive very little training that enables them to meet the communication needs of people with dementia. And this can lead to an increase in stress and distress behaviour. This presentation focuses on communication in the context of dementia. However, the strategies we discuss could equally apply to those who have communication difficulties as a consequence of stroke or other neurodegenerative conditions. We have also included some resources regarding specific conditions in the useful resources section at the end of this presentation. The content of this webinar will include dementia and communication, a brief overview on loss of communication by stages, a look at effective tips and strategies for improving communication. We will then take a closer look at communication difficulties and then present a couple of case studies before showing you a couple of video clips kindly produced and supplied by NHS Education for Scotland, which demonstrate effective and less effective communication, and the impact that this can have on someone's presentation. We will then provide you with an overview of resources available, including those from NHS Education for Scotland. Dementia is an umbrella term for a group of diseases in which there are progressive changes in thinking and daily functioning. And how dementia affects each person will depend on how each disease affects the brain. And there are many different types of dementia. The most common is Alzheimer's disease. As the illness progresses, people experience sensory changes and memory problems, causing everyday activities to become increasingly difficult. Memory loss, confusion, difficulty speaking and listening all contribute to communication challenges. Adaptations and tailored communication skills can help you interact more effectively with people with dementia. People living with dementia may have difficulty with communicating their needs or emotions, understanding us and our intentions, and responding to what is being communicated to them. So maximising opportunities for helpful communication through daily care tasks can reduce the likelihood of the person becoming anxious, frustrated, angry, or distressed. Loss of communication skills follow a different pattern for different types of dementia and can vary by individual. This table here outlines what to expect in the different stages of dementia. In early dementia, this may cause the person living with dementia to experience difficulty concentrating and following conversations, difficulty finding the right words when speaking or writing, losing their train of thought when speaking, and repeating oneself. Usually the person with dementia is aware of these problems and may try to hide or overcompensate for them. In the moderate or mid stages of dementia, the person may encounter difficulties following one-to-one or group conversations. They may also lose their train of thought when speaking. They may have increased difficulty finding the right words when speaking or writing. experience a loss of vocabulary, including substituting words that sound the same, or maybe inventing new words. They may also experience difficulty following storylines in books, TV shows, or movies. Problems with following directions may also be apparent, and poor recall when telling others about recent events may also be noticeable. You may also find there is an increase in the use of gestures when they're trying to communicate. In the more severe or late stages of dementia, there may be an inability for the person to follow along with simple conversations and instructions. It may be an increased loss of vocabulary, including personal information and loved ones' names, and an inability to follow storylines in books, TV shows or movies, and a tendency to talk about nothing, or they may appear to be rambling or babbling. In the end stages of dementia, people are likely to have an inability to speak or respond verbally. They may also have difficulty understanding when they are being spoken to, and all communication may be non-verbal. So we'll now take a closer look at effective communication tips. Adapting the way you interact with a person with dementia, which enables you to support effective communication, can help to reduce or even prevent distress. And there are various strategies that can be used, which we'll now take a look at. It's important to speak slowly and clearly, as this allows the person to hear, process, and understand what is being said. Maintain eye contact, as this gives the cue to the person that you're communicating with them. It can also provide reassurance. To maintain eye contact, it may require you to get down to their level by sitting down beside them. Be patient, as it can take longer for a person with dementia to process what is being said. So being patient and allowing them time to process information is likely to minimise frustration. Try and avoid asking the person too many questions or giving too many choices, as this can be overwhelming for someone with communication difficulties and lead to increased anxiety and distress. And keep questions short, and if possible, ask questions which require simple responses, such as yes or no. For example, would you like a cup of tea? Listen and try to find meaning. Knowing the person really well helps you to understand how they communicate their needs. Taking time to listen and work out what someone is trying to communicate is very important, and again, as with other communication tips, is likely to reduce or prevent any escalation in distressed behaviour. It is important to try and avoid getting into battles with people, as this can lead to increased agitation and frustration. Offer clear step-by-step instructions, and maybe ask if they've understood what you've said. This could be either in the form of a yes-no response, or getting them to point to a thumbs-up communication card if they're unable to vocalise their response. Using visual cues can be incredibly helpful in trying to understand what that person's needs might be. Having a set of communication cards with different objects, such as a drink, a meal, or the toilet, can help aid effective communication. However, with some picture exchange communication systems, training is required. Non-verbal communication and body language becomes really important for a person living with dementia, especially when speech is impaired. Offering reassurance can be easily achieved through non-verbal communication, such as smiling, nodding, a gentle touch on their shoulder or hand. And it can also be reassuring to sit down beside them so you're at their level. But it's important to remember to give adequate space, as this can also help to facilitate or improve communication. And it can also demonstrate you are listening, you're engaged, and interested in what they're trying to communicate. Using touch, sights, sounds, smells and taste can also be very effective in supporting communication, as this can help the person to understand the environment around them and help them to feel safe. And finally, avoid using elder speak, often referred to as baby talk. It's often used to try and show compassion, but can have the opposite effect. For example, saying to a person living with dementia, "Come on, eat your dinner, there's a good boy," or pop yourself down there, Angel, can increase their distress and agitation. And remember, good, effective communication can prevent or reduce any escalation in distress behaviour.
Let's take a closer look at communication. So the way we communicate has the potential to reduce, prevent, trigger or exacerbate distress behaviour in people living with dementia. This next section considers non-verbal communication, behaviour as a means of communicating an unmet need for a person with dementia, and the importance of getting to know a person with dementia to facilitate an understanding of what their behaviour may be trying to tell us. As we have discussed, people with dementia frequently lose the ability to speak as the condition progresses. However, they continue to communicate in other ways through body language, gestures, and facial expressions. Indeed, 55% of our communication is non-verbal. The remaining 45% is made up of the words we use and the tone and pitch of our voice. Non-verbal communication provides clues about how someone is feeling and what they may be trying to communicate. And this is a two-way system. We also need to be aware of our own body language and what this may be conveying to a person with dementia. Think about how you appear to a person with dementia if you are angry, happy, sad, or frustrated. Think about your posture. What do you do with your hands? How do you stand? What is your face expressing? What gestures do you use? Consider this scenario. Your line manager has just refused your annual leave. You're upset, frowning, and about to help an individual with personal care. Your approach may be perceived as threatening by the person with dementia. They may feel frightened and lash out. This incident may have been avoided if you approach the person with a warm smile, for example. It is important, therefore, to consider what our facial expressions or body posture may be communicating to others. These are some of the behaviours that can be exhibited by people with dementia. Repeating actions, words, or gestures. This can involve asking the same question again and again. Repeating a task, such as packing and unpacking a bag, and making multiple phone calls to family and friends. Being restless, perhaps pacing up and down in a room or a corridor, or fidgeting, showing signs of anxiety. Shouting or repeatedly calling out for someone or something, perhaps a person, place, or object from the past. Showing a lack of inhibition, which could involve addressing people inappropriately. Indecent exposure, undressing in public places, and improper sexual behaviour. Walking around during the day or night, constantly following a loved one, carer, or care worker. Becoming increasingly suspicious, suspecting people are plotting against them, trying to catch them out, or are hiding things from them. Becoming confused or disorientated at the end of the day, a condition sometimes called sundowning. Or being anxious and agitated, frequently a direct result of the profound nature of and changes brought about by dementia. It is important to remember, however, that no two people experience dementia in the same way. A person's behaviour will be influenced by so many things. For example, the type of dementia the person has, their personality, their health, and the support and environment around them. Most behaviour that is or may appear to be challenging happens when a person with dementia has a need that is not being met or is trying, probably unsuccessfully, to express their feelings. So in this context then, rather than referring to behaviour in dementia as challenging, it is probably best understood as distressed behaviour, as it is a person's inability to communicate an unmet need that leads to an increase in distress, as illustrated by this diagram. For example, you're working with a person living with dementia and they scream out repeatedly. Is it because they have advanced dementia, or is it because they might be trying to communicate pain or discomfort? Let's now consider a couple of case examples. Case example 1. Jenny is a 73-year-old lady who was diagnosed with mixed dementia 3 years ago following a period of cognitive decline. The nature of Jenny's dementia means that she's forgetful of events and has difficulties with recall, word finding and disinhibition. Staff have noticed that Jenny becomes distressed at certain times throughout the day, shouting and hitting out at other residents and staff. ABC charts revealed that this behaviour tends to occur in the morning when staff try to help Jenny out of bed and help her with personal care, again in the afternoon prior to lunch, and then again after dinner. Following an information sharing session with Jenny's family and others involved in her care, several suggestions were made as to what unmet need Jenny may be trying to communicate based on an understanding of her pre-morbid personality, preferences and life story. Prior to her diagnosis of dementia, Jenny was a hard-working lady who liked to keep busy. She was fiercely independent and determined and was never one to complain. She was someone who was particularly house-proud and liked organising, cleaning up and keeping things tidy. Jenny also liked to relax of an evening and enjoyed watching the soaps on television. Jenny has chronic pain and arthritis and was previously prescribed strong pain relief, which has been reduced over the years. Given that Jenny is someone who would not complain about pain, it was suggested this could be a factor influencing her distress, particularly in the morning when staff try to help her out of bed. It was agreed that Jenny may benefit from receiving her pain relief medication before being assisted with personal care. Staff agreed to allow a period of time of at least 20 minutes from pain medication being administered to helping Jenny out of bed. Given Jenny's need for organising, cleaning up and keeping things tidy, staff suggested creating a rummage box, perhaps including some tea towels, items that Jenny could organise or fold, and other cleaning utensils such as a duster and brush and pan set. Jenny always changed into her pyjamas after tea time and settled down to watch television. Given that she can become distressed around this time, it may be that this is what she's trying to communicate. Staff agreed to assist Jenny into her bedtime clothes after tea time. This may also help to orientate Jenny to the time of day and help her to relax before bed. So in this example, Jenny's hypothesised needs were around pain, anxiety or the need for relaxation, and meaningful activity. Let's look at another case example. Colin is an 82-year-old gentleman with a diagnosis of Alzheimer's dementia who has recently moved into a care home. Care home staff have been finding it difficult to care for Colin due to behaviours such as shouting and physical aggression towards staff. He has also started to put tables in front of his bedroom door. ABC charts revealed that Colin would become distressed most frequently when staff were entering his room. Staff would go in and out of Colin's room several times per day to give him medication, put his clothes away, or just to check that he was okay. Staff were confused as to why Colin was responding to them in an aggressive way. Although Colin did not have many family members, staff were able to talk with his cousin about what type of person he was and gather a background history of Colin's life. Pre-morbidly, Colin lived on his own and was very independent. He was never married and was described by his cousin as a solitary person who was content with his own company. He was someone who liked routine and consistency and struggled with change. With this knowledge, staff recognised that Colin's behaviour was likely an indication of his distress due to a change of environment and routine. To increase predictability and familiarity, therefore, it was decided that Colin should be supported by regular members of staff rather than agency staff where possible. Given that Colin lived on his own and did not socialise very much, staff entering his personal space was likely to be very distressing for him, and hence why he tried to keep staff out of his room by barricading his bedroom door with furniture. Staff therefore tried to reduce the amount of times they entered Colin's room, and if this was necessary, to limit this to one member of staff. Staff were also encouraged to knock on Colin's bedroom door prior to entering, introduce themselves, and advise Colin of the reason for their visit. So in this example, Colin's hypothesised needs were around safety, consistency, and predictability. Understanding what behaviour means is often achieved through a process of information gathering. The more we know about the person with dementia, the more likely we are to understand what they may be trying to communicate to us. Look for the person behind the dementia. Think about what they have done in their lives and their personal likes, dislikes, important relationships, culture, and beliefs. This may well give you a clue to their behaviour. Bearing this in mind, Alzheimer's Scotland's network of dementia nurse consultants and the Scottish Government produced a document called Getting to Know Me. It aims to give hospital staff a better understanding of patients with dementia who are admitted either for planned treatment, such as an operation, or in an emergency. The form can be used to record details about a person who can't easily share information about themselves. For example, it can be used to record a person's cultural and family background, important events, people and places from their life, their preferences and routines. The leaflet can also be used in any setting, at home, in hospital, in respite care or in a care home. Getting to Know Me helps health and social care professionals better understand who the person really is, which can help them deliver care that's tailored to the person's needs. It can therefore help to reduce distress for people with dementia and their carers. It can also help to overcome problems with communication and prevent more serious conditions such as malnutrition and dehydration. This document can easily be displayed and utilised by all staff, including those who may not know the individual well. For people with little verbal communication, communication cards are a great tool to utilise. For example, if an individual seems distressed, you can use these cards to rule out if they're hungry, need the toilet, or if they're too hot or too cold.
Firstly, I would just like to acknowledge and thank NHS Education for Scotland for allowing us to include material which they have developed. This includes 4 short video clips highlighting how staff communicate and interact with 2 individuals who have a diagnosis of dementia, Josie and Jim. The first 2 video clips we would like to show you are based on a woman called Josie. The first video clip demonstrates when communication is less effective and how this can lead to an increase in distress.
Josie, I told you I'm busy. I'll come back and see you later, okay?
The second video clip of Josie we would like to share with you demonstrates an example of how communication can be used to good effect and in turn alleviate distress.
Hi, Josie. I'm George. Remember me? We had a little chat earlier on. How's little Archie doing?
Oh, Archie's fine now. He got wet and he didn't like it. We were out a walk on the beach.
He's well behaved, isn't he?
Uh-huh.
Listen, I just thought I'd come and check up on you, okay? Make sure everything's all right.
I'm okay.
If there's anything you need, give me a shout. I'm just going to go prepare the dining area.
Oh, I'm going to get something to eat.
You are indeed. It's nearly lunchtime.
Oh, good. I'm awful hungry.
I'll speak to you in a bit, okay?
Oh, thank you, Tom. Oh, Tom is awfully nice.
I would now like to introduce you to Jim. The first video clip demonstrates when communication is less effective and how this can lead to an increase in distress.
Okay, Jim? Are you all right?
It's such a shame to see Jim like that.
I know.
But you know, I heard he used to teach art. I think he was a bit of a painter himself. He even had exhibitions. You'd never think that now.
It's a shame, isn't it?
Mm-hmm.
But what can we do? We've hardly got a minute, and he wouldn't be able to paint or anything like that now.
Yeah, I know that, but it's such a shame. You know that art group in the community centre? I heard he set that up years ago.
Oh, I know the one you mean. But what can we do? We haven't got any time. I've still got so much to do. I'll speak to you later.
Okay.
The second video clip of Jim we would like to share with you demonstrates an example of how communication can be used to good effect and alleviate distress.
And what about that one, Jim? Do you like that? It's wonderful, isn't it? Yeah. Let's have a look at another one. Oh, yes. You like this one, don't you?
Monk.
Yes, Jim, that's right. You know, when I started your art group, I didn't even know who this artist was. Let alone how to hold a paintbrush the right way until you showed me how to do it. Yeah, in fact, I've come a long way since then, Jim. This just won me the Mayor Award. See that technique there? That is something you taught me. Do you remember the Mayor Award, Jim? No? Because your name is one of the first names on the list. Well, this is all down to you, Jim.
Okay.
You know, you've no idea how much you taught me back then.
These 4 short video clips of Josie and Jim demonstrates how the style of communication used can contribute significantly to someone's presentation and well-being. This includes the ability to reduce or increase an individual's level of distress. There are a number of useful resources available online which can aid communication. The first resource we have included is Talk With Me, which is a free app that can be downloaded. It uses symbols, images, and photographs to help with basic communication. Next is Fast Talk Booklet, which includes the alphabet, numbers, words, and pictures to help people express themselves. As mentioned earlier, Getting to Know Me is an information sharing support tool to enable person-centered care. It helps professionals better understand who the person is and how to help them in a meaningful way. The Picture Exchange Communication System, also known as PECS, is a unique communication system which can be used by both adults and children. PECS teaches a person that by giving a picture of a desired item or action to their communicative partner, their request will be understood and actioned. Training prior to implementing PECS is recommended. ESOL is a free online picture dictionary. It is a simple picture communication tool that is readily available to use online. iCoon is a global wordless picture diary. You can purchase the book or app online. This is a useful tool for individuals who do not speak English or have reverted back to speaking their native language. Following on from this is Boardmaker. It is an online platform where you can create interactive and engaging materials for people with communication difficulties. You can use existing material or make your own. Communication cards are a visual tool used to overcome communication difficulties. They can be used with individuals who do not speak English or again have reverted back to speaking their first language. And finally, we decided it would also be helpful to include a number of useful websites for information on aphasia, which is a term used when a person has difficulty with their language or speech. If you're viewing this webinar today as a family member or carer, I'm about to go through a number of useful resources from NHS Education for Scotland, otherwise known as NHS, which highlight the importance of communication skills at all levels in person-centred care. These resources are aimed at all health and social care staff working with people with dementia. Please feel free at this point to continue watching or ending the webinar. The first NES resource I would like to highlight is the Promoting Excellence Framework. This framework is for all health and social service staff working with people with dementia, their families, and carers. It stipulates what knowledge and skills are required for those working at the different practice levels. This includes the informed, skilled, enhanced, and expertise level. Next is Informed About Dementia, which is an improving practice video and can be accessed through Turas. In 2016, the Dementia Skilled Improving Practice Learning resource was updated. This resource includes a very useful module on top communication tips when caring for someone living with dementia. Another useful NES resource would include the Promoting Psychological Wellbeing for People with Dementia and Their Carers. This is an enhanced practice resource. Section 4 looks at communication between people living with dementia and their caregivers at an enhanced level. This resource includes a useful model of communication and looks at the following areas of communication in more detail. Non-verbal communication, a focus for communication, feelings, watching the way we speak, three-way communication, and distressed behaviour. This resource highlights the importance of communication skills at all levels in person-centred and empathetic care, and the importance of being able to listen with all your senses and feelings when communicating. There are further training packages which NES offer. For example, there is a 2-day Stress and Distress in Dementia training course, and this training also covers a section on communication. If you would like further information about this training, please speak with your line manager. I'd now like to draw your attention to a leaflet which was produced by NHS Greater Glasgow and Clyde Older People's Psychology Service. This leaflet was produced with the aim to provide general guidance, useful tips and resources for people working with communication difficulties in dementia. It is readily available to be shared in PDF format electronically and will be available in leaflet form. Please don't hesitate to get in contact with somebody from Older People's Psychology Service to request a PDF and/or order a number of our communication leaflets. Thank you for taking the time today to listen to our webinar on communication difficulties in dementia, useful guidance, tips and resources. We hope you have found it both useful and enjoyable. Please feel free to share this webinar with those who may find it helpful, and don't hesitate to get in touch if you have any questions.